Hello, curious minds, and welcome to Have More Babies. I'm Stella. Today, we're tackling something that a lot of families grapple with, sometimes quietly, guiding a child towards a healthier future when, let's face it, the world often pushes in the other direction. We're going to look closely at a really powerful tool, telemedicine, and explore how it's becoming, well, a bit of a game changer. We're drawing insights from an article by Omega Pediatrics. Just imagine, maybe this is you, a busy parent, juggling everything, trying to get your kid to specialist appointments, maybe miles away. What if that expert care could, come right to you? That's really our mission today, to explore the efficacy, the benefits, and the challenges of using telemedicine for childhood obesity. We want to give you that shortcut to being well informed.
Okay, let's unpack this because the numbers themselves are, frankly, alarming. They really highlight why this is so urgent. The World Health Organization reported that the number of obese children under 5 jumped from 32 million back in 1990 to 41 million in 2016.
That's a huge leap. It really is. Think about that 9 million more in just over 20 years, and that's the youngest group. So this means childhood obesity now affects more than 18% of kids and teens. It's actually the most common chronic disease in childhood now. So before we get into solutions, let's just make sure we're clear. When we say childhood obesity, what exactly are we defining?
Yeah, that's critical because it's definitely more than just, a little extra weight. Clinically, your child is considered obese when their weight gain isn't proportional to their height gain, according to specific growth charts from the CDC, the Centers for Disease Control and Prevention. It also involves body mass index, or BMI. For obesity, a child's BMI needs to be above the 95th percentile mark for their age and gender.
95th percentile. So basically heavier than 95 out of 100 similar kids.
Exactly. And it's not just a label. It's a really important early warning. What's often missed is that this percentile changes as a child grows. It's tied to their specific developmental stage, which makes accurate, consistent tracking absolutely vital. And that tracking, that's something telemedicine, as we'll see, can really help with.
That makes sense. It's dynamic, not just a single number. So, okay, what's driving this? Why are so many kids facing this?
The million-dollar question. And the answer is, well, it's complex. It's this mix of behavior, genetics, sometimes specific medications, and definitely the environment a child grows up in.
Environment like their neighborhood?
Yeah, think about their surroundings, their school, childcare, the neighborhood layout itself. Is it safe to play outside? Are there parks nearby? Even simple access to affordable, healthy foods and drinks plays a huge role. It's not just about individual willpower, it's the whole system. And the stakes are incredibly high. Overweight children face serious health risks down the line: type 2 diabetes, high blood pressure, high cholesterol, even things like asthma and sleep apnea. It really underscores how important it is for parents to foster healthy eating and active lifestyles, but crucially, with support from healthcare systems and providers like Omega Pediatrics.
That paints a clear, if maybe a little sobering picture. So, given all that complexity, we definitely need innovative solutions. Which brings us back to telemedicine. How does this remote technology actually work in the specific fight against childhood obesity? Why is it potentially a good fit?
Right. Well, let's just define telemedicine in this context first. Fundamentally, it's using remote communication and information tech, think video calls, apps, connected devices for healthcare. So that could be for consultations, diagnosis, even creating and managing treatment plans, all without being in the same room.
Okay, so video chats, apps, I get that. But you said managing childhood obesity needs a multidisciplinary approach. That sounds like a lot of different specialists. How does telemedicine handle that, especially with kids where you need nutrition, activity, maybe psychological support, all tailored and involving the family?
That's precisely where it shines, because telemedicine interventions can be highly customized to what each child and family needs. So for a child struggling with obesity, you might have a coordinated team. Imagine regular video check-ins with a registered dietitian, a physical therapist guiding exercises remotely, maybe even a psychologist for emotional support or body image issues.
All through the same system.
Potentially, yes, all through a secure platform. And their progress, it can be tracked continuously through remote devices like smart scales or activity trackers that send data right to the medical team. The platform also becomes a hub for education and support for the family. Think regular resources like tailored exercise plans, healthy recipes, maybe even links to online support groups with other families going through similar things. It makes it integrated, not just separate appointments.
That sounds incredibly comprehensive, at least in theory. But, practically speaking, for real families, what are the actual tangible benefits? Is it making a real difference in outcomes, or is it mostly about convenience?
That's a fair question. And the evidence suggests it's really both. Convenience is a big part, yes, but it translates into real impact. One of the biggest pluses is simply better access to specialized care. Think about kids in rural areas or communities without many pediatric specialists.
Right, getting to appointments can be a huge barrier.
Exactly. Telemedicine lets them connect with these experts from home. It cuts out travel time, costs, parents needing time off work, kids missing school. And this better access also leads to better coordinated care. It helps the dietitian, the physical therapist, the pediatrician, all communicate and work together more effectively. That multidisciplinary approach becomes much more seamless. And does it actually work? Well, studies are suggesting it does. For example, one study in the Journal of Telemedicine and Telecare found that kids receiving telemedicine treatment for obesity had a significantly greater reduction in BMI compared to a control group getting standard care.
Okay, so measurable results.
Yeah, measurable results. And beyond just the numbers, it provides that crucial ongoing information and support. It gives families the tools and knowledge to make those necessary lifestyle changes stick. It's empowering.
Okay, empowering and effective. Now, I have to ask about the practical side, the cost. Sometimes new tech in healthcare means higher costs. Is telemedicine actually more affordable here?
That's a really important point, and yes, often it is.
Yeah.
Telehealth treatments can be genuinely cost-effective.
Yeah.
I mean, think about it. Fewer in-person visits means less travel, no parking fees, left time off work or school. Those savings add up for families.
Definitely.
And studies have actually shown that telemedicine weight management programs can be less expensive overall than the traditional in-person models. And crucially, they're still linked to positive outcomes, like those lower BMI readings compared to standard care. So you're often getting similar, maybe even better, results potentially at a lower cost. It's a real win-win.
That is compelling. Access, results, cost savings. It sounds great, but okay, let's be real. No solution is perfect. Every innovation has its challenges. What are some of the hurdles telemedicine faces, specifically for childhood obesity?
You're absolutely right. It's not a magic bullet. There are definite challenges. A big one is just access to the technology itself. Families need reliable internet, suitable devices like a smartphone or a computer, and the healthcare providers need to be comfortable using the platforms effectively.
The digital divide.
Exactly. That can be a real barrier in some areas, rural or urban. Then there's the concern about maybe a more superficial relationship. Telemedicine sometimes lacks that personal face-to-face connection. Some families just prefer that in-person interaction, especially for sensitive topics concerning their child's health.
I can see that. That connection matters. What about other practical things like getting it paid for, insurance?
Right. Insurance coverage has definitely been a hurdle historically. For a while, many plans didn't fully cover telemedicine, limiting access. The good news is that's changing. Insurers are seeing the benefits and covering more services, but it's, still evolving. You have to check your specific plan. We also need to remember it's not for everyone. Some families just prefer in-person. Others might struggle with digital literacy, making the tech itself a barrier. Or there could be language or cultural factors that are harder to bridge virtually. And of course, data security and patient privacy are huge. We're talking about sensitive health data. Robust safeguards and strict privacy compliance are absolutely non-negotiable.
Those are really significant practical points. And beyond the logistics, whenever we talk healthcare, we have to talk ethics. What are the key ethical considerations we need to keep front of mind when using telemedicine for childhood obesity to make sure we're doing it right?
Excellent point. Ethics are paramount. Firstly, while it improves access for many, providers have an ethical duty to ensure all patients can access care, regardless of location, income, or background. We can't let telemedicine create new disparities.
Right. Equity is crucial.
Absolutely. Then there's the potential risk of misdiagnosis or just an incomplete picture. A virtual visit can't always replace a full physical exam. So doctors using telemedicine need to be really aware of its limitations and know when an in-person follow-up is essential for proper care. And patient data confidentiality, as we touched on, is vital. Protecting that information from breaches isn't just technical, it's a core ethical duty.
Okay. What else?
Patient education is key ethically, too. Providers must clearly explain potential risks, give families the clear option to choose in-person care instead, and provide very clear instructions on what to do in an emergency. And finally, integrity of care. Providers need proper training, not just on the tech, but on the pros and cons of telemedicine itself so they can use it responsibly and effectively.
So we've covered the problem, the telemedicine solution, its benefits, the challenges, the ethics. Let's bring it back to you, the listener, especially if you're a parent. With all these moving parts, How important is your involvement in making telemedicine actually work for your child?
Oh, it's fundamental.
Yeah.
Absolutely fundamental. Parents are the primary shapers of a child's health habits and lifestyle choices. In a telemedicine setup for obesity, this means actively participating, attending those virtual consultations with your child, understanding the plan. It means helping monitor their diet and activity, not like a police officer, but as a supportive partner. And motivating them, celebrating small wins, helping them bounce back from setbacks. You're the constant in their daily life. And does this actually move the needle? Well, a study in the Journal of Medical Internet Research found clear evidence. Parental involvement led to better outcomes. Parents who were actively engaged reported being more satisfied with the program, and importantly, their kids stuck to the treatment plans better.
Makes sense. So if the goal is, say, more veggies,
Right. If the parent is on board, planning meals, buying the veggies, encouraging the child, that goal is much more achievable than if the child is just told, eat more veggies in a virtual call and left to figure it out.
totally. But let's be honest, parental involvement isn't always easy either, right? Parents are stretched thin.
Exactly. It comes with its own challenges. Some parents might feel they lack the knowledge or confidence. Others face real barriers, time constraints from work, maybe other family responsibilities. That's why the telemedicine programs themselves need to be designed to help parents get involved, not just expect it. That means providing clear, easy-to-use resources, offering flexible scheduling for calls, and involving parents right from the start in designing their child's personalized health plan. It has to be a partnership.
Okay, so let's pull this all together. What's the big picture takeaway here? Childhood obesity is complex, no doubt. It needs a really comprehensive, supportive approach. And it seems like telemedicine can really help make that happen, coordinating care, providing education, offering family support. Plus, it's often cost-effective and allows for that close monitoring. It feels like it's about making that specialized care more accessible, more integrated into everyday life.
Yeah, I think that's right. And maybe the big question is, what's the most significant shift this represents? For me, it's how telemedicine can potentially bridge those gaps in care and really empower families to manage chronic conditions like obesity. It brings healthcare closer to home, literally. It really highlights how crucial it is for everyone, providers, parents, kids, to work together towards a healthy, active lifestyle. It allows for more proactive care, catching things earlier.
And for any parents listening, please know you aren't alone in this. For more support, for counseling, for advice on preventing childhood obesity, or just to learn more about the services we've talked about, please visit omegapediatrics.com. That's OMEGPEDITRICS.com. We at Omega Pediatrics are really ready to help parents with the right support and guidance for our young patients. Because, you want to prevent those complex health issues later on, and early steps can make such a difference. And hey, if you found this deep dive useful, if it gave you something to think about, please take a second to like this video, subscribe to our channel for more discussions like this, and maybe share it with someone else who could benefit from this information. Thank you so much for joining us for this deep dive on Have More Babies. We really hope you feel a bit more informed and empowered on this important topic.
Yeah, it was great exploring this with you all. Keep learning, keep asking questions, and keep making those informed choices for your family's health. It really starts there.
We'll catch you on the next deep dive.